The 7 symptoms of appendicitis you shouldn't ignore. Do you know the symptoms of appendicitis? Appendicitis is an illness that is caused by the blockage and inflammation of the appendix, a small organ that is connected to the first part of the large intestine. This causes difficulties in the blood flow in the area. Thus, as the pressure increases, this causes an inflammatory response that affects your health. While the exact function of this organ is unknown, this condition can be fatal if it is not treated in time. This is because the bag can explode, thus quickly spreading the infection to other parts of the digestive system. Reason, it's essential to know the signs, given that medical intervention is vital to avoid complications. Bearing in mind that some people do not know about them, we want to dedicate this blog to the 7 symptoms that you shouldn't ignore. Don't ignore them. Sharp abdominal pain. The appearance of sharp abdominal pain is one of the first signs of this illness. This symptom, which evolves gradually, is the result of the inflammation and the pressure on the organ. You usually experience it in the lower right part of the abdomen. Then, its intensity varies over a time scale of hours. However, in many cases, the pain is also felt near the belly button or in the lower part of the back. This symptom tends to get worse when sneezing or moving the legs or abdomen. Nausea and vomiting. Next, the sudden appearance of nausea and vomiting can be a warning sign of appendix inflammation. These symptoms, together with a feeling of weakness, are common in patients who are developing this illness. This happens in 90% of cases. Usually, it's after first experiencing a strong pain in the lower abdominal area. If vomiting occurs repeatedly, the person needs to see a doctor. Although this is not always a sign of this illness, it may indicate that something is not right. Constipation or diarrhea. Some appendicitis patients have difficulty expelling feces. However, others face episodes of diarrhea. These digestive symptoms, which can also be caused by other illnesses, are the result of the inflammation of this organ. They tend to affect patients over the course of the day. In most cases, they are accompanied by gas and inflammation. Abdominal distension. Abdominal distension is an uncomfortable sensation of feeling full and pressure that tends to occur due to digestive difficulties. This makes the belly look swollen, even when it's slim. This is common in cases of appendicitis. It results from the inflammatory reaction in the tissues and the accumulation of gas. Fever. The symptoms presented by this illness tend to be similar to those experienced by people with stomach and intestinal infections. together with the pain. It's therefore very common for the patient to present moderate fever and shivering. Thus, it's essential to see a doctor if the fever increases or reappears constantly. If the temperature increase is mild but it appears together with abdominal pain, it's also necessary to go to the doctor. Appetite loss. Even if the person usually eats well, they may suddenly lose their appetite. The inflammation of this organ interferes with digestive functions. In many cases, it inhibits the production of hunger hormones. This should be attended to immediately, because not eating well can lead to nutritional deficiencies. However, it's important to analyze this symptom together with other signs. After all, it also shows up with other illnesses. Rebound pain. Rebound pain is a symptom that enables appendicitis to be identified more precisely. This tends to happen during a medical checkup, as it appears when the lower right part of the abdomen is pressed. It's a sharp, stabbing pain that varies in intensity when pressure is applied. When the affected area is released, the pain is felt more severely, and this enables the illness to be identified. Are you experiencing any of the symptoms of appendicitis mentioned in this article? If so, it's best to see a doctor as soon as possible to determine whether or not it's due to this illness. Attending to the problem immediately enables greater success with the treatments to control it.